Today's very good topics, which is temporary, which is long-term provisional cases. So a lot of people have some questioning about how can we build either dentist side or the laboratory fabricated. But today is the day, so I want to show you how can we make these long-term temporizations from unique way. You really want to watch it? Stay tuned.
Use the before and after from not tested
Hi, I'm back. Regarding make the good long-term provisional cases, number one, we have to see the individual model, which is tooth individual looking, and then mount together properly. That's number one rule. So mounting is very important. Why? Because we can diagnosis, meaning the one dentition and then shorter teeth, increase the length, and what's their expectation goal. So we technically, this is a treatment plan related, okay, started. So if I want to make the really good temporizations, I want all the time the diagnosis, the model from the mounting together. That's number one rule. And number two, after I mount it together, and then we see the all occlusion analysis, meaning how much tooth is left. Is it grounded and 2 mm down or 3 mm down? Or they want to change the cosmetic from the irregular shape or open space or the closed space, or what look like shape and contour. So number three, laboratory have to prep it. So that is why I need the reduction is extremely important between doctors and I. But some doctors, they prep more. Some doctor prep less, depends on the patient. But here's my goal. I do not want to grind more than doctor. So meaning, if I grind too much and then maybe patient need a root canal, I don't want that. So that's my goal. So I'm trying to save the enamel as much as possible so doctor can trim it and then they can make the temporization or reline it. Right? So number three options, obviously number four, I believe. Okay, number four options, after we prep it and then we set the teeth or trying to make diagnostic wax up roughly, I call it mock up. After we make this, all right? And then we make the five and then contouring, the better shaping, which means my part, I have to put it into more my passion, make the looks like the tooth as close as possible. But my recommendations here is if doctor prep already, that's great. But if I prep, I do have limitations. So I all the time make it a little bit more thicker than they think because I don't want to get any fracture. So nobody want that. So number five, I want to make the good longevity. So I want to put the linger, make the custom, as you can see, the linger we wax and casting, and then we put the all full protection to back side, which is a lot of labor intensive. But it can be, it's a very expensive one, but I'm trying to give them the economy way as much as possible. And then we final contour, they make the acrylic, so it's more stronger. And the doctor can do reline, repair when patient is there. This is much easier, okay? So they can do that. The most important things I would like to talk to you. Why is temporizations? They have to sit it temporarily in the patient's mouth, and then you can heal back the gum tissue. It's much nicer, and then you can wear it. what feel like, how much thickness, what do you think about the color. That's why you need it. That's the main goal, right? But once you set up temporary, right? I know I do have about 20% patients really high demand. They want something. They want everything. Meaning, it's a problem. I'm 30-year experienced technician and patient driving all the way different direction, and I cannot do that. How can you do that? Nobody can do it for you, right? Unless you don't care about teeth. Who doesn't care? Right? Everybody care about their teeth. So if you care, you need a good temporization, proper temporization from the laboratory side, and the doctor can prep the teeth before they take the impression. They can go to temporization. That's awesome solution, right? And then you can watch all those information and video, and feel free to contact your doctor. Like I said, I talked to numerous times. I'm not a dentist. I'm a lab technician, right? I just fabricate it. I just want to make good teeth for you. That's it. So do not so just contact your doctors. We cannot recommend anybody, but we do nationwide dentists. They send here daily basis. So I hope this video will help. With more video, you can prescribe it. You see way more video than you think. Okay, see you next week. Thank you.